Here are 6 main recommendations for healthcare professionals to use AI responsibly. 1. Build AI literacy. You don't have to become a data scientist, but you should understand the basics: how AI models are trained, what their limitations are, how bias can creep into recommendations. This foundational knowledge allows you to critically assess AI-generated outputs, rather than accepting them at face value. 2. Verify before you act. AI can support clinical decisions, but should never replace them. If an AI tool flags a potential drug interaction or suggests a diagnosis, verify it against trusted clinical guidelines, peer-reviewed literature, or expert opinion. Your judgment is still the final safeguard for patient safety. 3. Protect patient privacy. Never feed personally identifiable patient data into public AI platforms or unapproved apps. If you are using AI-assisted dictation, translation, or summarization tools, make sure they are HIPAA or GDPR compliant and approved by your institution's IT or compliance department. 4. Embrace institutional guidance. Most hospitals and health systems are now developing policies for AI use. Follow them closely. If your institution provides secure, internally validated AI platforms, use those. They are designed to keep patient data protected and ensure compliance with legal and ethical standards. 5. Communicate with patients. Patients deserve to know when AI is part of their care journey. Explain in plain language how these tools support decision-making, and reassure them that final decisions are still made by trained clinicians, not machines. Transparency builds trust. 6. Stay current. AI is evolving fast. Set aside time to stay updated on new regulations, emerging risks, and evolving best practices. Attend workshops, read professional society statements, and join discussions on responsible AI use in clinical practice. Responsible AI adoption is not just a technology issue, it's a professional responsibility. By building literacy, protecting privacy, and maintaining human oversight, healthcare professionals can make sure AI enhances care rather than undermines it. This is how we ensure AI becomes a tool for better medicine, not a source of harm. Thank you.